Hello friends and welcome to the channel. In this video, I'll be discussing the typical life of a medical student from the time you finish your class 12th and you get selected for an MBBS by qualifying NEET till the time you actually become a practicing physician or some faculty member in a medical college or a private medical college or some private hospital. This is a long journey and I've been through most of the exams and I'm almost about to finish this journey. So I'll give you an overview because many of you are just maybe class 11, class 12 students or maybe young students doing MBBS right now. So of course it starts with qualifying NEET and entering this beautiful journey of MBBS. Now, all of you know that this is a 4.5 year course, 19 subjects in 4.5 years, and you become a medical graduate. You finish MBBS, okay? And within MBBS, the course is divided into four professional exams. You have first year, second, third, and fourth, okay? The second year is of 1.5 year duration. The rest of them are approximately 1 year duration. So it becomes 4.5 years. And then is the internship. So once you complete your MBBS, you're done with the theory part, you're done with the clinical teaching, which is generally you experience in your third year and fourth year of MBBS. Now in internship, a student is exposed to all the departments of the hospital and the college. Okay, so he gets posted in clinical departments, he gets posted in general medicine, in general surgery, in obstetrics, gynecology, pediatrics, and all other specialties, anesthesia, ENT, ophthalmology. So the purpose is twofold. One, to give the finishing touch to the theory that a student has learnt in the MBBS. Okay, so build his practical skills. And the second thing is that a person finds a particular branch of interest. So once you experience the workflow and the environment and the quality and the type of work that a resident, a doctor does in each and every department, you decide which one is good for you. So for example, a person who is posted in general surgery during internship falls in love with surgery and then subsequently he chooses to become a surgeon for the rest of his life. Okay, so that is the second important, the purpose behind internship. Now, internship is for 1 year. It's a mandatory 1 year course, internship. And once it's done, then there comes another NEET or now an INICET, okay? And that is another entrance exam for a second course, which is called junior residency. Okay, now there is one more type of junior residency, a non-academic junior residency. You're typically called a junior resident or a house surgeon at that point of time. Well, that is when you fail to qualify for the NEET PG, fail to qualify the INICET, and you somehow join a non-academic course, during which time you get paid as much as an academic junior resident. Okay, so what I mean to say is that junior resident can be academic or non-academic. And academic means you're into a new course, a 3-year course of either MD or MS. So MD is for medical branch, MS is for surgical branch. For example, MD in medicine, MD in pediatrics, and for surgery, MS in general surgery, MS in ophthalmology, MS in ENT. So that's another 3-year course. And during those 3 years, now you're no longer a student practically, you are the workforce of a given medical college or hospital. You are there in the wards, in the OPDs, in the operating rooms. You run the hospital basically. So this is 3 more years. So 5.5, that's 4.5 of MBBS plus 1 year of internship plus 3 years of junior residency takes you to another course, which is senior residency. Because let me be frank, no one is a perfect physician just immediately after finishing the junior residency, just immediately after finishing MD. And invariably people, all of the graduates and postgraduates, they obviously do senior residency again and again. Like junior residency, it can be an academic or non-academic course. So it can be a senior resident non-academic or senior resident academic. And the name change here. Now it's no longer MD and MS. There has to be a different name for a super specialty course. This is called a super specialty. And the names are DM and MCH for medical and surgical branches respectively. So for example, in the medical fields like nephrology, cardiology, gastroenterology, endocrinology, the label is given as DM. In surgical disciplines, things like cardiothoracic surgery or maybe gastrosurgery, so there the name is given as MCH, or surgical oncology, the name is given as MCH. And this course is another 3 years. So 8.5 plus another 3 years, and this is without a break. It's going to take you 11.5 years. So without a single break, non-stop, you qualify all your entrance exams and join the next day of your college. It's still going to take you 11.5 years to become a practicing physician, to finish your MBBS, your internship, your MD or MS, and then your senior residency or DM or MC. So it's going to take you 11.5 years. Now the point is, why is this course, this medical field, so extensive, so vast? Why does it take 11.5 years for you to become a practicing physician or a practicing surgeon? Well, the point is, the learning in medicine or surgery, it is a steep curve. You cannot be trained to cut down someone's chest and dissect someone's heart and treat someone's vessels around the heart or the chambers of the heart or defects inside the heart in just 2 years. It's not possible. So you're finished. Every step gives you a different layer of experience till you reach to that point when you can be such a super specialist that you are actually eligible to surgically treat cardiac conditions, or surgically dissect various complicated tumors, or surgically dissect tumors inside the heart. Or I'm doing DM in cardiology. It took me 10 years almost as of today. So 10 years for me to be eligible to treat someone with a heart attack by opening his occluded arteries inside his heart. So this is a complicated task which takes time to learn, and it is mandatory for you to pass through these stages. It is mandatory for you to go through these 11.5 years to become a practicing physician or a surgeon. Now the point is, it is not boring, it is not difficult, it is a joy. It is wonderful to have such an experience from different disciplines, and throughout these years you accumulate so much of experience and so much of practical knowledge that you finally fall in love with your profession. And plus, after your MBBS, you're obviously paid. In your internship, you'll get a meager, that's not a salary in fact, but just 20,000 as sort of as a stipend, and something you actually will be able to do your day-to-day work with that money. But then in your MD and in your DM, in your junior residency, in your senior residency, you are well paid, at least in central institutes and also in many of the peripheral institutes. Yes, there are exceptions. Some states have lower salaries for junior residents or senior residents, but by and large, you are given an adequate salary through those 6 years of junior residency and senior residency. So I hope you got an idea about this medical field and what you're supposed to do after you crack NEET UG and join MBBS as a medical student. Thank you.